Today I'll be showing you how to do medication administration for an IM injection. With all medication administration, what you want to do first is check the doctor's order against the MAR. And once you look at that, you want to make sure you have the right patient, the right medication, the right time, the right dosage, and the right route. Once all of that match up, you can get your equipment ready for your injection. Which for IM injection, you can use a 3 milliliter syringe, and you have your needle, and you have gloves, and you're ready to wash your hands. Once you have all of your equipment, the next thing you can do is go into the med room to check your medication. You'll do 3 checks. The first check is you go to the patient's name, um, to the patient's chart, and make sure you have the right medication and administer the right route, and make sure that you have everything in order. That's your first check. The second check is you want to recheck to make sure that you pulled the right medication. And once you've done your second check, you can start getting your syringe ready for administration. With your needle, what you want to do is you want to make sure the inside is you don't want to touch the inside. So what you want to do is the amount of medication you're gonna give, you're gonna pull back that much air. I'm gonna get 1 milliliter. Okay. Make sure you're at 1 milliliter, and you grab your medication, and you're gonna put that air in there, and come back, and you're gonna make sure that you don't touch the inside. You're gonna pull back to get to 1 milliliter. Okay. Once you have that, next thing you want to do is check the inside if it has any bubbles. What you want to do is you want to lightly tap till you have the bubbles. Once the bubbles are out, you'll use the scoop method, which I'll show you. The scoop method to have that until you're ready for it. Once you're ready to go to the patient's room, once you're ready, you'll go to the patient's room and you'll knock. Once you go in, you introduce yourself. Say, "Hi, my name is Jacob. I'm a student nurse, and I see you have an IM injection scheduled for today." And you want to check the wristband, the patient's wristband, asking for the name and date of birth. That's your identifier. And another identifier you can, if you have a picture, you can use the picture and match it. Okay. Once you have identified the patient, you'll clean your hands, wash your hands, and put on gloves. Once you have put on your gloves, you'll identify the site that you want to give the injection. And for an IM injection, okay, for an IM injection, the good place to do the injection is the deltoid. The deltoid right up here. And what you want to do is when you give the medication, you want to give the medication, you want to make sure the site, you want to check the site, and you'll use these 2 fingers to check the site, and this area in between, that's where you give your injection. Okay. Once you pick your site, you'll clean it with alcohol, making sure that all that's clean, and then you're ready for your injection. Clasp it. And with IM medication, you want to go in at a darting motion, and it's 90 degrees. So you'll do your dart. You want to aspirate. Make sure you don't have any blood. If you don't have any blood, you're in the right spot. And you'll give your injection and pull out. Then you'll use the little cap right here. Lock this, and you'll throw it in a sharps container. Okay. And you can't put a Band-Aid, or if it's like small little dot of blood, you can put gauze and pressure. Okay. And you want to tell the patient to move their arm. You don't want that arm to get stiff. Once you do that, you can take your gloves off, wash your hands again, and that's when you'll document the medication, you'll document the site that you used, and the route that you used, and you want to make sure you do your 6 rights, and then you'll clean up your area and you'll be done.